Okay, perfect. We are live. Giovanni, thank you very much for taking the time to be here. And first of all, before we start, I would like to thank you, everyone that is watching us live today or watching us later, for taking the time to be here and for showing interest for this subject. We really, really appreciate your time. So very briefly, what we're going to talk today is about COVID-19 and how the pandemic has deepened the ongoing situation that the ongoing crisis that the Venezuelan is going through at the moment, and we will explain a little bit more in a couple of minutes. With a very special guest, Giovanni Valera, who is joining us from Venezuela, from Ven da Tu Mano. So Giovanni, thank you for being here. So I'm just going to go through a few housekeeping notes on how we're going to run through the presentation today. So we will cover the whole presentation and conversation in 40 minutes. We will address questions or comments that people have at the very end. And you can leave the questions in the comment box that you see below in Facebook. And if not, you can email us later on if you have any question to us. So the session will be split in two parts. At the very beginning, I'm going to talk about what VCI is very shortly. Then I would love to give you some context about the humanitarian crisis that Venezuela is going through. And then we'll bring Giovanni to the spotlight because we're going to have a really live and insightful conversation about the work that Ven da Tu Mano, or Give Your Hand, is doing in Venezuela to fight COVID-19 and the work from healthcare workers in the country. So finally, this Facebook Live, it's going to be recorded. So if you cannot see it, stay for the 40 minutes. We will be sharing the link and you can catch up on later. So the following slide, Karen, please. So Karen, I have Karen at the background, another VCI member who's going to be helping me with the slides. So I'm going to be calling her to change it throughout the conversation. So following slide, Karen, please. Okay, thank you. So who we are, who is VCI, in case you don't know us, you are seeing us for the first time. VCI, or the Venezuelan Community in Ireland, is a non-profit organization that was established in 2017 to work towards the integration of Venezuelans living in Ireland and into the Irish society. We promote our culture or values in the country, and we also support people in vulnerable conditions in Venezuela. So we are a non-profit, and very important, we are all volunteer-based. We have about 30 volunteers since 2017 that have been working with us and collaborating and supporting with different activities. So the following slide, please. So how we work, we essentially have three main, basic areas. So we participate organizing multicultural events previous COVID-19, really important to say. At the moment, we're not going into any live event because here in Ireland, we are in lockdown number 2. So we can't, this year it's been difficult for us, but we're doing things like online events. We do fundraising activities through the selling of handcrafted goods made from partner organizations, and all the funds that we collect through this online events, live events, and fundraising activities, we redistribute those funds and medicines. We also collect medicines to Venezuela, to other non-profit organizations that work in Venezuela and have specific projects to tackle the issues around food and health crisis, and especially for people in vulnerable areas and conditions in the country. And Ven da Tu Mano is one of those partners. The following slide, please. So before we get into the conversation with Giovanni, I really wanted to, when we were planning this activity, we said, okay, we need to give a little bit of context as to what do we call the complex humanitarian crisis in the country. What does that word and phrase mean? Because it might be people that doesn't, from here in Ireland, that doesn't have much context, doesn't really understand what we are actually talking about. So according to the United Nations, a complex humanitarian crisis is defined as when in a country, region, or society in which there is a total or considerable break of the authority as a result of internal and external conflicts, and in which requires international response that goes beyond the United Nations programs that are operating in that country already. So it's basically there is a break on the capabilities of the country to provide basic needs. So in that context, there are a large number of people in extreme vulnerability and that produce severe and devastated conditions for the people living there. So in Venezuela, the United Nations claimed that it was going through, since 2015, an economic crisis. There is food insecurity, there is an education crisis, and there is health insecurity. That it's what we are actually tackling and we're going to be talking today. And in the following slide, I'm going to give you the very, like a very short snapshot of the alarming stats that the country is facing at the moment in the health sector. So the first one is 1.5% of the GDP represents the public spend on health. This is 67% below the global standard and the lowest in Latin America and the Caribbean. 61% of emergencies in the majority of the public hospitals, and in Venezuela, there is a very distinction between public and private, which in other countries that's not necessarily the case. In the country cannot provide services on a regular basis. And 22% stop working, and 53% of operating rooms are closed. 53% of medical staff, mostly from the public health service, resigned from their jobs and have left the country. The total bed deficit in Venezuela rises to 64% of the total beds available in the country. I don't have the exact numbers, but from what I was reading was around 26,000 beds. 40% is out of service due to damage, budget, lack of personnel, etc. There is also a really critical situation, and Giovanni probably is going to talk us more on the conversation in a couple of seconds about the shortage of medicines in pharmacies. That in fact rises to 85% in the country, and in hospitals it's 83%. So this is something that it is very, very critical. And the scale of maternal deaths increased by 66% and 30% of infant deaths from 2015 to 2016. And just to give you context, all of these stats were taken from a report done from an organization called Venezuela, which is an independent platform developed by the Venezuelan civil society for monitoring, documenting, and following up the complex humanitarian crisis that affects the country since 2015. And you can see all the reports, both are in Spanish and English, in their website. So this is this is me in the conversation with all the stats and I guess all the information that we want to cover today. So if we go to the next slide. Yeah, so let's talk about Ven da Tu Mano, Giovanni. All the spotlight now, it's going to be with you. So first of all, can you tell us a little bit more about what you do with Ven da Tu Mano, what Ven da Tu Mano is, and what is the work that you guys are doing in the country?
I'm sorry, I had my microphone.
Yeah, sorry, I had you mute, but I think you're now okay.
Okay. Well, first of all, I want to thank you all for inviting us today to this conversation. It's really important for us to let people know, especially those interested in donating, know what the context in Venezuela is. Starting with Ven da Tu Mano, we are a non-governmental organization, an NGO, that first started its operations in 2017. And the main goal is to provide aid to people in need in vulnerable situations in urban and rural areas of Venezuela. There are several programs in Ven da Tu Mano that mainly focused on delivering medicines from abroad to Venezuela to be given to people in need through health programs. But Ven da Tu Mano has been constantly adapting to the times that we are facing. And right now, Ven da Tu Mano is developing a program especially designed to deliver personal protection equipment to different hospitals and healthcare organizations around the country. This is one of the main focuses right now because of the PPE shortage is common to be seen around the world. So you can imagine how it is seen here in our country.
Great. And can you, so just to get into the details of the conversation, so you guys were working on different programs, so you have to kind of pivot to cover the ongoing situation or to aid the ongoing pandemic that it's not only happening in Venezuela, but it's also happening globally. So yeah. Before we get into that detail, can you tell us, okay, what are the procedures or official procedures that are in place in the country to handle the pandemic? And could you give us like a little bit of that day-to-day that the healthcare worker has to go through in order to be in compliance with those procedures or to assist or aid the people that get contagious or has the virus? Can you tell us a little bit more about that?
Sure. If you listen to if my connection starts lagging, let me know because my internet connection is right now a little bit slow.
Yeah, okay.
So, about the official procedures for handling COVID-19 here in Venezuela, people, there are constant speed tests, rapid tests being done in the communities, but it is never enough. So there are two main problems here in Venezuela. First of all, that there isn't enough testing for the people, and on the other side, the people doesn't want to be tested because they don't know what is going to happen if they test positive about COVID-19. So we have to see the problem in two sides. First, there's not enough conscious awareness campaigns to let people know that you have to be aware if you are positive for COVID-19 and take care of yourself. And on the other side, people are afraid of what is going to happen if I test positive. What are they going to do with me? Where am I going to be? Am I going to be in isolation, in a hospital, in a main care facility? I'm going to a hotel where everybody's sick. What if? And another thing that people think here in Venezuela is that, what if it is a false positive, and they take me to where there are people really sick, and I get sick there. So
Hmm.
people don't want to get tested, and people that are present that have the cardinal symptoms for COVID-19 tend to hide it from society, because nobody wants people to know that they are sick of the particular disease. So we in Ven da Tu Mano are not only providing PPE for the healthcare workers, but we are always on constant campaigns to raise awareness of why you have to come forward if you're presenting symptoms, and to know that you have to be I mean, it isn't socially wrong to be positive. You have to take care of yourself, take care of your society, and don't infect other people.
Yeah, I guess there is little awareness in terms of what does this mean, not only for your health but also for the health of the community and the people that live there. And we were when we were going through the questions, you were saying that there was a social stigma around being positive or have COVID-19, and people, as you were saying, people is afraid even to going into the system and get tested, and then when they get tested, they don't even want to know they don't want to say they are positive because it's not seen good and because they don't really know what's going to happen. And I guess it's all coming from this failing of the capabilities of the health system in general and the public system, which is probably where most of the people in the country, especially in these communities, are going through. If they don't have clarity of what's going to happen to me, if there is no really awareness as to what does it mean for my health, for others, it is really difficult to get people, I guess, on board and follow the system. So just to go back a little bit, you were saying at earlier on that, okay, people, first of all, some people don't want to get tested, but what happened with the people that do go to the program? I guess I'm not sure what's the actual word for the whole process. And what do you have any kind of can you paint us what happened with someone that goes, where does that person goes firsthand, how it take cares, and talk us a little bit more about that if you have any example.
Excuse me, India, I just lost connection. Can you repeat me the question, please?
Yeah, so can you tell us a little bit more about what happens when a person goes to a hospital and they get tested? What are the doctors are giving them a special instruction? So can you give us a little bit of insights or information around that if you have an example?
Of course, yeah. Let's talk through a normal patient that would test positive. There are two possibilities. First of all, you may, depending on the symptoms of the patient, if you're asymptomatic, you are you are put in isolation in special facilities for asymptomatic patients. But there is another scenario where right now these facilities are not being used like they were used in the beginning of the pandemic. Right now, people are being sent home when they are asymptomatic because of what I told you before. These facilities for asymptomatic in the doubt of what is going to happen if I am a false positive and I am put in a facility with someone that is really sick. So right now, people that are being tested positive, and because of course the availability of the resources, they are being sent home. Okay. Another scenario is when you are actually sick, when you are presenting symptoms. If you're tested positive and you're presenting symptoms, you are sent to a hospital where you are taken care according to your symptoms. The main problem is when somebody gets need a respirator, when somebody gets need an ICU, there is no availability for giving attention to everybody that is needing it. So everybody is getting the attention as far as it can be delivered by the healthcare workers that are excellent and do everything they have in their hands to solve people's problems.
Okay. Okay, great. Now, with these examples, and I guess you are super involved in the local communities where you are, from your perspective, in your opinion, can you give us, I guess, your opinion as to how you think all of this situation is affecting the healthcare workers, the patients, knowing that you guys are coming from, so I think COVID-19 hit the country in March this year.
Yeah.
It's where you guys started presenting.
In March, we started the quarantine because there were some cases, but the main peak of the pandemic started around May, beginning of June.
Okay. And so I guess, can you give us your opinion? How do you think all of this situation, the pandemic, is affecting you guys, the healthcare workers, the patients, the communities? And can you also talk us a little bit about the formal information that the government is placing? Do you track how many cases are in the country? How available is that for people? And can you tell us a little bit more about that?
Yeah, to be honest, there is some official information given by the government daily, but the accuracy of that information is very doubtful because, as we talked before, there is never going to be enough testing because the ideal scenario is for everyone to have access to testing. The other scenario is people hiding data from official institutes like the hospital because they hide the disease from everybody, and there is the outdated information because I think, and this is a personal opinion because as you know, we don't have access to official information, or at least not real. I think the information that is given has some weeks of outdated when it comes out because I think the processing of the data is outdated as well. So when we see the numbers from today, those might be the numbers from like 2 weeks ago.
2 weeks ago. Okay. So yeah, and when I was preparing all of this, and I think I mentioned this to you in here, the European Center for Disease Prevention and Control. This is can you hear me? Okay, I think Giovanni is freeze at the moment and he's having some network issues. Let's wait for a couple of minutes. But yeah, so as I was saying, the European Center for the Disease Prevention and Control in Venezuela is shows that at today there are 98,655 cases in the country, and there are 863 deaths to date. So as Giovanni was saying, that probably it's out of date, probably it's from 2 weeks ago, and because some people, there is not enough tests, this number of cases and deaths in the country might not be the actual reality that they have. Let me just go back here to see if we can get Giovanni back to the conversation. There is some issues with network and internet in the country. He has left the room, but I guess he will join in a few minutes. So while he joins again, I hope he will, I'm just going to check here yeah, what people is telling me. Perfect. Okay, so yeah, so let's go through the. Oh, here it is. Sorry, add to the stream. You are back. Can you hear me?
Can you hear me?
Yes, perfect. All good. Can you hear me okay?
Yeah, I can hear you.
Perfect. So
I was using the internet here on my phone.
I know, no worries. I did the explanation, so no worries. So I explained to the audience that how many cases are now in the European Center for Disease Prevention and Control, but because this might be out of date and because there are not enough tests in the country, this might not be a realistic figure. Now, can you give us your opinion? Because one of the main subjects of the webinar was also to understand a little bit of how the pandemic has deepened this crisis in the country. From your opinion, your perspective, how do you think that has happened? I think we're all clear at this point that the pandemic has just accelerated and aggravated the already fragile healthcare system. But give us your opinion.
India, I'm losing you again. I was texting you through my phone because I
Sorry.
can't hear you well. I'm sorry, my internet is failing on me.
No, it's okay. Yeah, so can you hear me okay now?
Yeah, I can hear you. Can you repeat me the question, please?
Yes. Can you give us your opinion as to how from your perspective and the work that you do in communities, how the pandemic is deepening or increasing the ongoing healthcare system crisis?
I'm sorry, how the pandemic? I lost you there.
How the pandemic is affecting the ongoing healthcare system crisis?
Okay. Well, right now, the main problem is always, I mean, the problem has so many factors to be taken care of, but Ven da Tu Mano has organization is taking care of the lack of personal protective equipment because there is lack of medicines, there is lack of conditions of many things, but we think that the main people putting their hearts on it, on giving attention to people, are the healthcare workers, and we have to take care of them because if we fail on them, then there's no one going to be there to give people attention. So there is one specific thing that many times we forget about, and that is the sanitation teams in different hospitals, because we always talk about the doctors, we talk about the nurses, we talk about the healthcare team that is taking care of people. But sometimes in these kind of programs, we don't think about, and Ven da Tu Mano is actually thinking about the sanitation people that is disinfecting the floors, disinfecting the areas where there's COVID-19 patients. They're using chloride to clean the floors, to clean the areas, for it to be safe to work, because the healthcare workers are constantly in exposure to the virus, and we have to take care of not only of personal protective equipment, but as well for materials to disinfect these areas and to give people knowledge. So another important part of our give people, to teach them about the latest information that is available around the world to take care of these conditions.
Excellent. Yeah. And I think that's super, super important. As we said earlier, there is little awareness as to how this might affect them, how to take care, what are the procedures. And it's really interesting the point that you made there about, because we don't tend to think too much on this, but when these global situations, a pandemic, it shakens up everything. And small things like taking care of the areas, the floors, the beds, the bedclothes, everything in the areas where people with COVID-19 is in taken care of, and not having the resources, the equipment, even the personnel, the people,
The knowledge.
the knowledge, it is so critical, isn't it? So that is really, that's an extra problem as on the daily um, on the daily basis and operations that a normal hospital would do. And not only not having the full resources, but people, even water, electricity. We know that there is some shortage of water into hospitals or electricity. And now is, okay, now I need to take care of an area that has been infected by a virus and I don't know how to. I don't have the resources, I don't have the material, etc. So I think it's a challenge, and for everyone there in really. And can you? It's 30. We have 31 minutes in the live, so we're going to start wrapping up. Can you tell us what are the initiatives or projects that Ven da Tu Mano is doing? So can you talk us about the security kits? Do you have any latest figure? How many of them have you been provided to healthcare workers? And any other comment that you want to give to the audience today, so we start finishing the live.
Yeah. Right now, we started as Ven da Tu Mano to give out these personal protective equipment in every state in Venezuela, and specifically in many of the major hospitals. The reach has been quite interesting because at the beginning we thought it was going to be a problem to have access to give this out, but through and personally to every doctor, we have delivered these kits through the services, through their, for example, we contact the head of a service and we provide information about what we're going to give out. They receive these kits. And one important factor about this kind of intervention is that we always maintain our focus on being impartial and neutral. So we are always focused on delivering this kind of PPE kits through the humanitarian principles of intervention. So the reach has been quite big. We've given out more than 10,000 equipment. If we take in account the face shields, the N95 respirators, the overall, the antibacterials. I have to go through the words to translate them in my head. It's been quite amazing how people like you there in Ireland, in other parts of the world, has been aware of what we're doing here in Venezuela, what we're doing through Ven da Tu Mano, and how we have created a great team that through your donations, through donation of people like you, Indira, there in Ireland, people in Ireland, that sometimes, and it's really, really grateful for us to see people that are not Venezuelans helping us. So the call out to everybody is to donate, to give out a hand, like our name is, to people here in Venezuela. And one of our principles, now talking about the implementation principles we have, is to give out the results to our donors to let them know that the work is actually being done. So thank you very much.
Excellent. Thank you, Giovanni. So I guess the people is asking, how can I support? This is a really interesting and super important job that you guys are doing. How can I get involved from Ireland, from here? How can I support you? So the following slide, Karen, please. Yeah, so in VCI, we have done this beautiful project to support Ven da Tu Mano, to give more equipment and security kits to healthcare workers. We've put together a raffle that is live in rallyup.com. And when you go to that link, don't worry, we'll put the link in the comments, and it's going to be on our social channels. And when you go to the link, you'll be able to buy tickets to be in a chance to win a painting from Juan Pablo Ayala, who is a VCI member and also a very talented artist, has made this replica of the Cabré Avila. For the people that doesn't know, the Avila is a national park that is in Caracas, Venezuela, the capital of the country, and divides the valley of the city from the Caribbean Sea. And it's that what, if you go to the next slide, Karen, we will be able to see, yes, that's the painting that we are going to be giving away in this raffle. So you have different ways of participating for that raffle, or you have different layers of tickets that you can buy. So the more you buy, the more chance you have to win this beautiful paint. And to remember, everybody, all of those donations that you are going to be given through the buying of the tickets are going to be for supporting the providing more security kits and equipment to the healthcare workers in Venezuela, and which Ven da Tu Mano is doing that work all in there and making sure that they go to the people that need them, and it's an equal distribution of the resources and the equipment and the kits. So I guess that is everything from today. Again, we are going to, sorry, I didn't mention about the raffle. The raffle is going to be live from today. The link, if somebody can help me to put the link in the comments, you will see the link also in our bio in Instagram, and we'll put it on Facebook as well. So that link will be live until the 13th of December, when we are going to do the actual raffle, and all the winners, sorry, not all the winners, just one winner, will be announced on our social channels, which are at Venezuelan Community IE on Instagram and Facebook. And Giovanni, do you want to give any final remarks, where to contact you, Ven da Tu Mano, the Instagram, or any final comments, and then we leave it there?
Yeah, thanks for the opportunity, Indira. I with the words that it's kind of amazing to see people around the world trying to help out the situation, not only in Venezuela but COVID-19 in general. So we are really, really grateful for giving us this opportunity to give out our context, to give out the work that is being done. It's never enough. Many organizations are doing it, and every time one more sums to this kind of interventions, the work is reaching out farther away. So our Instagram is Ven da Tu Mano, just like the picture you put before, VendaTuMano. That picture right there, Ven da Tu Mano. That's our Instagram. You can find out more of the work being done right there. And I hope we see another next time to keep telling you guys how things are going on here in Venezuela. Thanks a lot for this opportunity, and have a great day.
Thank you, Giovanni. Thank you, everyone, for who joined today, and we'll see you next time. Bye-bye.